Chalo, we start. Yeah. Last class, which was the remedy we spoke? Sticta. Any questions in Sticta? Any small clarification? So it was a very simple remedy, and as we discussed, predominant action on respiratory. And as you remember, it was both upper and lower. And there was also something very characteristic related to the knee. What was that? Very good. House-made knee. Okay. So if Sticta is clear, we'll start with a brand new remedy. And as a final year student, before I start this remedy, I would like to introduce this remedy with a case. Okay. So this remedy I have not used very often in my clinic, but I have used it, and a few cases where I have used this particular remedy, I will be sharing few cases in between. Okay. Now we had a case of a lady with renal failure. Okay. She was a very young lady, probably around 32, 33 years old lady with chronic renal failure. Okay. And her creatinine was somewhere around 5 plus. Urea was some 70 plus, and HP was very low. HP was some 7 point or 6 point change. Okay. Very thin, lean lady. Must be some 38 and a half or 39 kgs is her weight. Okay. And she is some 32 or 33, that age group. Okay. Now we took this case because one of the old student of this particular college, he had referred this case because this case they had advised dialysis. Two reasons: she was too young, and second thing is their financial status was not all that great. Okay. So they could not afford dialysis, and she was too young. So this gentleman from our college, ex-student of our college, he decided, why don't you try homeopathy? And that's how this lady landed up in my clinic. Very strong lady, okay, very positive lady and very angry lady. All these things initially I had considered, and I had given her ferrum. We had repertorized. I am just giving you the case in short, so that we don't miss on the remedy that we are going to discuss today. So she was given ferrum, and with ferrum there was some changes, but after a month again serum creatinine started increasing, which was 5 came down to 1.8, 1.9, and in spite of repetition she did not improve. Her creatinine levels decreased. And please do remember, in a case of CKD or chronic renal failure, hemoglobin is a very important parameter. Okay. Hemoglobin should increase. Fine. So in this given case, hemoglobin was not increasing. What was 6.9 became 6.6, 6.5. She was going bad. Okay. Somewhere we were contemplating to either give her blood transfusion or we'll have to send her to dialysis. That is the state she was in. Again the case was retaken, and one characteristic thing we saw in this lady was her BP was always high, 240 by 130. Okay, in spite of taking 3 anti-hypertensive tablets. Done? In spite of taking so many tablets, BP used to be always very high. She had giddiness, weakness, etc. So I was just trying to relook this case. I was trying to reanalyze this case. What was the problem? Where did I go wrong? What was the totality, etc. And in the totality, there came a remedy, and that is a remedy I am going to discuss today. And after prescribing this remedy, her hemoglobin has improved. Okay. Creatinine, blood urea levels have come down. BP has maintained. Then BP should not decrease in chronic renal failure, CRF. It should not decrease drastically. But in her case, it was very high. Okay. See, there was one rubric which I want to share with you: kidney complaints associated with hypertension. You are getting this rubric? So, renal failure associated with hypertension. One remedy that comes up is the remedy we will be discussing today. Now, I did not prescribe this remedy based on only this particular symptom. In the totality, the remedy came up, and the remedy also covered this PQRS. And what was that characteristic symptom? High BP, hypertension. Okay, hypertension associated with kidney complaints. Any wild guess which remedy I am going to discuss? I know I am left with only two remedies. One of you tell one remedy and the other can tell the other remedy. But please do use your common sense. What did I tell you? The lady looks very lean and thin. Okay, lean and thin. Fine. And the remedy which comes very close, and the remedy I had prescribed to this particular lady was Plumbum Met. Definitely she was a metal, very strong. That's how Ferromet initially did some magic. But that magic we could not sustain in spite of repeating Ferromet. And kidney cases and all, no? Especially CKDs, CRF, I generally repeat. Though I am a single dose prescriber, in this case, in CKDs, we repeat the remedy. I sometimes give daily, I sometimes give once in 3 days, once in 7 days, based on the case. Okay. So this case we gave Plumbum Met. You have Plumbum iode and a lot of other salts of Plumbum. But she being that metal, that strong lady, we had prescribed her Plumbum. Okay. So after Plumbum, she is beautifully improving. Must be with reports. One day I will share the case. I am just waiting for the further follow-ups. Once the case is complete, I will definitely share it with you. I have some 3-4 cases of chronic renal failure, doing very good with our medicines. So must be some other platform or some other day, we will try to discuss that. So today we will focus on Plumbum. And Plumbum, from the case that I have shared, what information did you gather? That Plumbums are generally, physically, if you look at the constitution, they are the kind of people who are generally lean thin. Okay, one. And what else did you also get in Plumbum from this case? Yeah, I mean mentally, okay, we are looking at the mind part. Other than that, the target area, the target organ. So Plumbum also has an affinity for kidneys. Correct, Allah? And then it also affects the heart. It also affects the blood vessels. These are few things that you can gather from this small narration. Okay, we'll go ahead and we'll try to understand. Now, before I talk of this, one second. Now, Plumbum, this I have taken from Google. If you read Plumbum, you know the lead, lot of information is given. Okay, fine. Pure lead, preparation is trituration. This is how we prepare in homeopathy. Okay. Now, when you look at Plumbum, what I have planned is, I am not typically giving you information from head to toe. That will take too much of time. We will focus on the important areas of Plumbum. At the same time, we will see to it, we will do justice to Plumbum and we will cover the entire picture of Plumbum. Okay? So, for our convenience, the Plumbum class will be discussed under the nervous symptoms. And I will also be focusing on gastric symptoms, very important. And I will be focusing on the mind, which we just discussed. And in the end, under the heading miscellaneous, I will try to cover all the PQRS and important points of Plumbum. Okay? So these are all the objectives. This is how Plumbum will be explained to you students. Okay? So 4 areas: nervous symptoms, gastric, mentals and miscellaneous. Okay? So when you look at the source books, when you look at Clark, when you look at Boric, Fataks, etc., E.A. Farrington, you will see that there are wide range of symptoms in Plumbum. Okay? My simple question for you as a final year student, from where did we get so many symptoms in Plumbum? Please take a small pause. Don't be in a hurry. I'm committed. I know you can answer. It's a very simple thing. I'm confident. But please give a small pause and try to understand the question. From where did we get so many symptoms? Yeah, can somebody? Very good. Lead poisoning. Good. Now, how will this lead poisoning happen? Okay, lead poisoning can happen from the work, meaning there are n number of workers who work in lead factories. Okay, lead factories. Fine. So they would have been exposed to lead, and they would come up with some symptoms of lead poisoning. Good one. Or any other sources, and lead contamination, especially the water, would get contaminated with lead, and people who drink contaminated water with lead, they will have a set of symptoms. And it was observed, once that contaminated water was stopped consuming, the symptoms would stop. So what I am trying to give you is the volume of symptoms that we have in materia medica is not only taken from drug proving, it is also taken from toxicology. Beautiful, you use the word lead poisoning, and that's why I always insist. What do I insist? The toxicological part, that is very, very important. Fine? The toxicological part is very important, which you would have studied in your FMT. Correct, Allah? So the wide range of symptoms of leadum, they have either come up from drug proving, okay, or you can also see that people who are poisoned, accidentally poisoned, or they have been exposed to plumbum in the workers from lead factory, or drinking lead contaminated water. We just spoke. And the last thing is the symptoms, the pathological symptoms which we have taken from people who have consumed lead and they have killed themselves. Okay, people who have attempted suicide, or people who have killed themselves using lead. So these are the sources from where the entire symptomatology of plumbum is collected from. Hope I am clear. Okay. So we will just focus on the action of leadum on muscles. Okay. So what is the action of leadum on muscles? Now, as you understand the drug picture, you will realize that plumbum acting on the muscles, it will cause atrophy. What is it? Atrophy. Right? Atrophy. See, when you look at the action of a remedy on a muscle, what are the simple things you can expect? You can expect myalgia, fine. You can expect inflammation, or you can expect hypertrophy, fine. So in plumbum, specifically what you see is, you see more of atrophy. The muscles go into atrophy. And I was just referring the repertoire yesterday. What it also says is this atrophy, which is progressive. What do you understand by progressive atrophy? Which is extensive, fine? Which is extensive. Progressive atrophy of muscles, which comes from spinal sclerosis. As a medicine student, there is something called as multiple sclerosis. It will come up next, which we call it as MS. And there is something also you need to understand called as spinal sclerosis. Now what happens in MS and spinal sclerosis? There is demyelination, there is degeneration, and whatever the information that has to go from brain, spinal cord to the different parts, that is cut off. I have a beautiful case of multiple sclerosis. I will share it a little later. Okay. Now what you need to understand is, plumbum is a remedy of high weightage. That's what I am trying to tell you. In serious conditions like spinal sclerosis, multiple sclerosis, one can think of plumbum. Okay. Slowly we will explore what are all the indications, when do you indicate plumbum in these conditions. We will try to understand. Now first area is muscles. Okay. See, for example, any other quick remedies, meaning other remedies acting on muscles? Causticum, okay. Gelsemium, good. You have simple remedies like myalgia, Restox, arnica, good, very good. I wanted arnica, Restox. Simple. See, now what I want you to understand is one tissue muscle and different remedies can have different action. Okay? If it is myalgia, we think of arnica. We don't think of plumbum in myalgia. Artha ಆಗ್ತಾ ಇದೆಯಾ? Plumbum is more deeper. Fine? Plumbum will not cause myalgia. Plumbum will cause structural changes wherein it can bring in atrophy. Now this is the clarity as a final year student you need to have. For everything you can't give arnica. For everything you can't give plumbum. Each remedy will have its own indications. That clarity you need to have. Fine? You go ahead. So this is the pathogenesis which is very, very important. Now a very common action. I mean, once you read plumbum, many of us remember this area, and that is GIT. So what is the action of plumbum on GIT? Okay. So now what you see is it mainly causes colic. It's very, very characteristic colic we have in plumbum. We'll take it up after some time, if time permits today, or if not in the next class. Okay. So for today's class, what you need to remember is plumbum acts on the abdomen, acts on the GA, and it will cause colic. One. Second very important point is it's a very good remedy for constipation. Okay. We'll look into the details, why constipation, what is the character of stools in plumbum after some time. All clear? Okay. So we'll go ahead. Third point, very important point is its action on the nervous system. Many metals, okay, you talk of zinc, you talk of platina, okay, you talk of aurum, many metals, they act on the nerves. So is plumbum. But what will plumbum do acting on nerves? Any wild guess? What will plumbum do acting on nerves? See now, as a final year student, you have this urge. What is that urge? Pathology is over, surgery is over, OBG is over, medicine is almost getting over. So you will have a better urge of understanding materia medica. Allah. So when I say what plumbum does acting on nerves, you know there are so many complaints related to the nervous system. Now what are those where plumbum acts is very important. So it mainly cause paralysis. Plumbum is known, plumbum is famous for paralysis. And hopefully in today's class, I'll be focusing only on the nervous system. Okay? We'll go systematic, step by step. So here it can cause convulsions, it can cause paralysis, it can cause twitching, it can cause certain involuntary movements. But more of paralysis and convulsions. Okay? We will also look at this area which you already know. What is it? Blood vessels. Blood vessels. So it will cause atherosclerosis. So what is atherosclerosis? There is deposition of cholesterol. There is deposition of cholesterol. Fine. And naturally what happens? Your heart has to pump more, pump harder, so that the blood reaches to the different parts of the body. So atherosclerosis leading to hypertension. Any quick remedy that you can recall here? Very good. Who was that? Beretta. Good. And you want to specify which Beretta? Any Beretta. Good. Very good. Beretta Muir. And what is the speciality of Beretta Muir in hypertension? Systolic increase, diastole decrease. Fine. So Beretta Muir or even Beretta Carr, fine, has the similar situation. Atherosclerosis leading to hypertension. Good. Very good. Keep it up. So we'll also look at this last area, and that is kidneys. Here, acting on the blood vessels, it can give rise to atherosclerosis, or acting on the blood itself, it can cause anemia. A very important remedy for anemia. Okay. Now this area is what is very, very important. kidneys. So what will plumbum do acting on kidneys? We discussed a case. Yeah, it can give rise to kidney failure. Nephritis, Bright's disease, or worst situation or a serious condition, what you see is kidney failure. Chronic kidney disease, CKD or CRF, you can think of plumbum. But don't give plumbum blindly for kidney affections. Because the 4 cases I told you I am treating, very recently, fresh cases. Each case has a different, conflict. Each case has a different emotions. Each case, why they went into kidney failure is a different story. Based on that story, we prescribe. Okay? So don't think any case you can give plumbum. No. Plumbum will have its own indication. We'll explore that a little later. Okay? So am I clear? We started with a remedy. Our remedy is through Plumbum Metallicum. Beautiful remedy, deep acting remedy. And it mainly has action on the 5 areas. Muscles to start with, then we also spoke of GI, and in between you have the nervous system, very important, and towards the left you have the blood vessels and of course the kidneys. 5 areas. Okay. Now we will try to explore the nervous symptom of plumbum. As a final year student, this is very important, meaning very often asked in your exams. Describe the nervous affections of plumbum or describe the paralysis of plumbum. Common question they keep asking. Okay. Now I already told you what could happen in plumbum. Paralysis, convulsions. See, paralysis is something as a practitioner, we know plumbum has beautiful action. But what I was surprised was plumbum has good amount of symptoms related to convulsions. Okay. Can you wildly guess what type of convulsions you can think of plumbum? I mean, when I say wild guess, I know we are taking a chance. But please do use your common sense. As a medicine student, as a final year student, what kind of convulsions one can think of plumbum? Huh? Okay, more than all that, focus on this area and try to think what is that convulsions that can happen in this condition. What is the good? Okay, good. Abhi is giving you a clue. He says metabolism. Okay, very good. Another uremic convulsions. Good, agreed. Another uremic convulsions. So plumbum can be one beautiful remedy for uremic convulsions. Done? Good. So this is how you link your medicine with material. Okay. Now we'll see what can plumbum do acting on the nerves. So there is a condition which I just explained. We have something called as MS. What is MS? Multiple sclerosis. And you can also think of plumbum in spinal sclerosis. I have a case of MS. I have only one case, and this guy is beautifully improving with, not with plumbum, that's what I am trying to tell you. This guy is improving it with Natronure 50m. Because Natronure was the remedy that covered his totality. He had a lot of emotional issues. Why did he go into MS? When any patient comes to your clinic, please ask this question, not to the patient. Patient might be in a position to tell you why he went into that state. But as a homeopathic doctor, always have this question in your mind. Why? Why this lady, why this man went into MS? Or why this man is having hypertension? Why this man is having sugar, whatever damn disease it is? That is the first question that you should put to yourself. Yake, what could have happened or what could have led to this particular problem? If you put this question, then slowly things will start unfolding. And many times we do explain to the patient, fine sir, 3 years back you were fine. Third year this started. Why did this start only then? Why not before or why not after? Make them understand. Make them educate. Fine, this is a beautiful science and this is how we unfold the case. Fine. मेरे को RA हो गया. Okay, fine, good. Why did you get RA? I have graves. Okay, fine. Why graves? Why graves? Why you? Fine. Is the question that should come to your mind. Please do question yourself. And then try to understand. Then try to connect the dots. It will be a beautiful connection. Okay. So that man, that the case I was just sharing with you, he was given natremure because he had a natremure ailment, he had a natremure mind, and natremure is also a very good remedy for MS. Right? So everything was taken into consideration. He was on allopathic medicines. The doctor himself has considerably reduced the medicines. Okay, fine. So MS symptoms are all fine now. Natremure 50m. I had given him high. I started with 10m because so much was the mental impact this man had. Illi natremure 30, natremure 6 will not help. Okay, when mind is in the background, never think of low potencies. In spite of pathology being grave. Okay, this is my experience. I might be wrong, I might be right, but this is how I am evolving. This is how I am seeing the cases in clinic. Higher potencies, they do wonders. And single dose of natremure 50m is doing good. Fine. So multiple sclerosis, spinal sclerosis, and you also have convulsions. You also have paralysis. Right? So we will be discussing the nervous system or the nervous symptoms under the following headings. Okay? So idu. So we'll just go ahead. We'll start with convulsions. Any quick remedies for convulsions from your side? Very good. Good. Cuprum, Cicuta, Zincamet, good. Naxomica, Sina. Yeah. Don't tell me chamomilla. Because subconsciously, whenever we tell Sina, chamomilla is also good remedy for convulsions. I don't deny. But don't tell it, what is it, out of compulsion. You can tell chamomilla. Then what will be the next question? Tell me the symptoms of chamomilla convulsions. Okay. So Sina, chamomilla, good. Zincum, Helleborus, Ethusa, yeah, Cicuta, and Artemisia vulgaris. You are a final year student. You expect some rare remedies also. Artemisia vulgaris, lot of remedies. Fine. So here we'll try to look at the characteristic convulsions in Plumum. Okay. So convulsions, you forgot a remedy. Now you might think of that remedy. What is this? Yeah, very good. What made you think of before? Good. Convulsions from masturbation. Okay. This is the decent picture I could get it from the net. Okay, there were worse pictures. I thought, I don't want any kind of. Oh yeah, anyway. Ailments from masturbation. What ailment you have in Plumum? Convulsions from masturbation. Okay, that's why a remedy which comes very close here is Bufo. Don't forget Bufo. Beautiful remedy. I have a case of a boy whom I am treating for convulsions with Bufo. Young boy, 10 years, 11 years, and what made me think of Bufo is not a very intelligent guy, and worst thing is his addiction to pornography. Porn. His addiction to porn. 10 years, 11 years, because of this online class, last 2 years now, mobile is given and we parents assume the child is in the online class, but child is in a different platform. Okay, so this guy is doing good and see the beauty. In the follow-up, he comes once in a month and I keep asking, one question I keep asking, I know conversions are important and I also keep asking, how about that problem? Fine? Illa uncle, no, that I'm not doing, I'm trying to overcome, I've overcome. In third follow-up he says, I've overcome. See the beauty of our remedies. See, I insist, we don't do psychotherapy. We don't tell them, boss, you're 10, fine, you should become 18, then start watching. Fine, it's not good for you. We don't do all those things. And because we have that faith, we have that strong faith in our medicines, what our medicines can do. Before 10 one dose was given to this boy. Fine. And see, after, don't expect tonight you give before and tomorrow he stops. There are few things which will take time. Because that's the distraction, no? You're just 10 years old, you have mobile in your hand, and any damn thing you can type, it will come. Fine? So, it's a very bad addiction. And addictions will not just go like that. You can't do magic. I put 2 drops of before and morning. Fine? You can't expect that. It will definitely take some time. But it will work. It will work. Fine? So before is one remedy you need to remember. Only before, bad effects of masturbation. See, yesterday I had a case of this young man, 27 years old man. His mother used to accompany him always. So he could not talk few things. Yesterday mother was not there. So he came up with his story. And what was the story is, he used to masturbate 7 to 8 times per day. Fine? 7 to 8 times per day. Okay? This was few years back. From 2010 to 2018 he has done. And then he realized what I am doing is wrong, etc., etc. And he stopped. It's almost 22 now, no? So he had bad migraines and all. I had given him pulsatile attendum. He improved beautifully. Yesterday I was trying to tell, sir, I feel mild weakness here, there, body pains. And today my mother has not come. I have something to share with you. I also had 2 girl assistants with me sitting. So we just requested them to go out, and then he unfolded his story. This was what I was doing then. Is it because of that? Fine. Have my nerves gone weak? Will I become a father tomorrow? Can I satisfy my wife tomorrow after marriage? He has got a lot of questions. They're all valid questions. Fine. Please don't laugh at them. Don't mock them. Listen. Listen to them and please give your sincere advice. Fine. What medicines can do, medicines will do. There are some cases that needs to be educated. Kindly educate them what it is. Okay. Don't brush it aside. You don't feel shy. Fine. And don't judge the person. Don't do all those things. Fine. So anyway, he had stopped on himself. Last 3 years he is not forcefully masturbating the way he used to do. Okay. So masturbation, in this situation, you also have to remember platina. Sorry for this color, but anyway, platina, bufo, calcarea carb and lacasis. A few more remedies which has convulsions from masturbation. And we also have convulsions during menses. Convulsions during menses. Again, you have plenty. Plantus is a rare remedy, you should remember. Calibyke, sickle and zincum are few more remedies. Now what you also have in plumbum, convulsions in old age, good, only remedy. Convulsions in old age, only remedy is plumbum. Okay? We'll go ahead and we'll see what else you have in plumbum. What is this? I'm trying to focus. Huh? What is this? It's a warning. What is it I am trying to discuss under convulsions? Yeah, the warning go. What is it? Very good. Aura. Aura. What is aura? Aura is an indication. Aura is a warning. Before convulsions, you get some warning. So what is that aura or what is that warning you have in plumbum? Okay. So plumbum before convulsions, they will have pain in legs. So before convulsions, they get pain in legs, and then the boy or girl, they throw a convulsion. The only other remedy we have in our materia medica is lycopodium. Okay, lycopodium plumbum. And swelling of tongue. Before convulsions, the tongue starts swollen or the tongue starts getting swollen. Then they throw a convulsion. So if this is the aura, the only remedy is plumbum. Swelling of tongue before convulsions, only remedy is plumbum. And vertigo, you have plenty of remedies, you can also think of plumbum. And convulsions without consciousness. What is this? Convulsions without consciousness. Any remedies that come to your mind? Huh? How is Naxwamika different here? Naxwamika, stramonium, sina are few remedies which has convulsions with consciousness. Meaning when he is throwing convulsion, he is aware of what is happening. When you are not aware of what is happening, when you go unconscious, then it is plumbum. Then it is, you have plenty of remedies like argentum, bufo, calcarea, cantharis, hyos, vonanthus. I mean, you are a final year student, you can go back and refer your repertory. You have plenty of remedies. As a material teacher, I am sharing few here. Okay. So this is about convulsion of plumbum. A quick recall, plumbum only convulsions. What is the cause for convulsions? Masturbation during menses, old age. Convulsions without consciousness. What is the aura? Pain in legs, in brackets, lycopodia. Okay, then you also have swelling of tongue, in brackets, only remedy. Then you also have vertigo. Okay, we'll go ahead, lot of things. If we go this slow, we'll have issues. Another beautiful condition. I'll share a case again here. Now, the idea of sharing cases is you get that confidence. Yes, I had a case, one of my very good patient who had referred another colleague of hers, and the problem was this lady, some 28, 29-year-old lady, she had paralysis. She had paralysis of legs. She had paralysis of legs. And this paralysis used to slowly go up, and it had come to the extent of chest, and it was going up. Now before we conclude, again as a medicine student, what is the diagnosis? Very good, GB syndrome. GB syndrome. In GB syndrome, you have ascending type of paralysis. See, patient will test your knowledge. Sir, आपको GB syndrome मालूम है क्या? सुना है क्या? सुना है? Fine. So naturally, if you want to have an upper hand, your knowledge will play a very important role. You tell them, ऐसा होता है, इधर से शुरू हुआ, अभी इधर तक आए ना, डॉक्टर साहब वही है. So psychologically he will be convinced, I am with the right man, or I am with the right doctor. At least इनको पता है, क्या पता है कि ये GB syndrome है. Fine, whether you treat or not, that is secondary. But at least आपको पता है. Now what is the second challenge? When you know the diagnosis, what medicine to give? So this lady, she had slurred speech, very young lady, 27, 28, she delivered, she was lactating the child and all. So her totality we had taken, and for her I had prescribed conium. See, I am not telling plumbum. You are getting my point? Because she did not fit into plumbum. Her symptomatology was very similar to conium. So after conium, now how should the Heringsla happen here? What should improve first? Don't tell the one which starts first will go last. Correct, that's also right. But you should go down, meaning her speech should improve, because this is the last thing that was affected, and slowly you should go down. Abhi wo chal nahi sak rahe, no issues, don't get stressed. In the follow-up you told she is not walking, no problem. Why should she walk now? What is more important for you? Which was the last thing that got affected here was speech. अभी बात कैसे कर रहे हैं? एक वीडियो कॉल करो, वीडियो कॉल, नमस्कार डॉक्टर साहब. Speech is good. जो slurred speech था वो गया अभी. So speech is good. Naturally it is coming down. Yeah, she will definitely walk. She is now also walking, but she has got that staggering gait. Yeah, that will go. So above down, Heringsla. Every case you should see. Only then it is homeopathy. We'll get back. Now this is what I was trying to tell you. GB syndrome. Alumina, calcarea, conium, lysine, a few remedies. You have few more in your repertory. You can look at it. See, another very characteristic symptom of Plumum. Please read this statement. What is it? Paralysis of, what is it? You have flexors and you have extensors. Flexion, extension. So those group of muscles which are responsible for extension, those group of muscles will go into paralysis. Okay? If it is paralysis of flexion, which is the remedy? If it is paralysis of flexion, flexor group of muscles, you have only two remedies. One is natrium and the other one is causticum. Now the other remedies, whatever you are trying to tell me here, okay, I will come to it. Now what happens when the extensors, fine, they go into paralysis? You can see from my hand, very good, you can see from my hand movement, you will have wrist drop. Wrist drop, wrist drop, wrist drop. So one remedy, in which wrist drop is prominent is Plumum. So there is wrist drop, not this, wrist drop, fine. So the extensor muscles, they go into paralysis and then there is wrist drop. Similarly, Plumum can also have ankle drop. Okay, ankle drop, fine. Okay, so please do remember the other remedies you all told me was alumina, arsenic, calcarea, cocculus and crotalus horridus for paralysis of extensor muscles. If it is flexors, natrium, Cypromalla, natrium, causticum. Natrium, causticum. Don't forget. Clear? We'll go ahead. So what did we start? We spoke of conversions. In the second slide, we are focusing on GB syndrome and paralysis of extensor muscles. In your exam, you need to underline this. Underline andre bold agi baribeku. It's very prominent in Plumbum. Ankle drop, wrist drop, highlight. They're very important. Now, what else you have in this thing? Multiple sclerosis, spinal sclerosis, all has to be highlighted. Very important. Yeah, we'll go ahead. Now, paralysis of single muscles. Okay. So we'll just try to understand from head to toe where else you can see paralysis in Plumbum. Okay. Now from here what you see is the upper eyelid, they go into paralysis. Okay, upper eyelid, fine. And if you look at the lower down part, the next part, tongue, the left side of the tongue goes into paralysis. Left side of the tongue goes into paralysis. So naturally when it is paralyzed, what is getting affected? Speech. So they will have slurred speech, speech affection, paralysis of tongue left side. So surprisingly you also have paralysis of palate group of muscles, they go into paralysis. Paralysis of palate, paralysis of tongue, and 1 second, what happened? Okay, chalo, that was not, animation was not done. In the GA, what is it that goes into paralysis? Fine. Especially the rectal muscles. What did we discuss in the spear affection? Constipation. Now you understand why there is constipation in Plumbum. The rectal muscles, they go into paralysis and there will be constipation. Okay. So paralysis of rectal muscles, and more than that we missed this part in between. Here there can be the esophageal muscles which can go into paralysis. So what happens when the esophageal muscles goes into paralysis? Yeah, swallowing will become difficult. So liquids you can swallow, but solids will come back. Solid food will come back to the mouth. Okay. So this is what happens in paralysis of esophagus. Okay, swallows, yeah, this I have explained. And paralysis of rectal muscles, we saw this. And you also have a photograph here, an image taken from Google. What you see here is the bladder muscles can also go into paralysis. So what happens when the bladder muscles goes into paralysis? There can be retention of urine, or urine is passed with difficulty, or there can be dribbling of urine. Okay, all these things are possible in Plumbum. Fine. See, I have gone systematic from head to toe so that when you are studying or when you are writing in your exams, you need not think too much. understand the concept and then start writing. Okay. So what is this? This is ankle drop. Okay. And paralysis of lower limbs. You have a beautiful situation explained in Fatak's Materia Medica. What Dr. Fatak says is paralysis of lower limbs after parturition. Now what did you understand from this statement? After delivery, the lady will have paralysis of lower limbs. If at all you get a case like this, 3 remedies should come to your mind. Okay? One you already know, Plumbum. The other 2 will be Restox and Phosphorus. No issues, Restox and Phosphorus. Okay? Paralysis after parturition. Paralysis during parturition. Okay, meaning you have finished your obstetrical postings. So during labor, during parturition, if the mother is going into paralysis, the only remedy mentioned in your repertory is cocculus. Okay, cocculus. Now we'll go ahead and this is what you saw. Now few more pointers towards plumbum. The indications of plumbum in paralysis. Few more points, and those points are paralysis accompanied with constipation. You saw that. And paralysis, the affected part is cold. Whichever part is paralyzed, that part is cold. A very important remedy here is Dulcamara. In brackets you can put Dulcamara. Okay? Affected part is cold. Fine? And affected part is oversensitive. There is hyperesthesia. What is hyperesthesia? Excessive response. Meaning, whatever straightest thing, they can feel it easily. See, these are all very characteristic, because paralyzed part, what happens? Yeah, there will be no sensation. But in plumbum, there is hyperesthesia. So tomorrow you get such case, you can think of plumbum. It's a characteristic symptom. Now this is again very, very characteristic. The paralyzed part will go into atrophy. So the paralyzed part will go into atrophy. All those group of muscles, you saw that, is going into atrophy. And paresis leading to paralysis. What is it? Paresis leading to paralysis. So what is paresis? Weakness. So muscle weakness, fine, leading to paralysis itself. So paresis giving rise to paralysis. Okay. Now before I stop today's class, we'll try to understand, just take 2 minutes time, try to recall the key points. Plumbum is the remedy we spoke. I gave you the sphere of action, and in that one area we are focused, and that is the nervous system. Acting on the nervous system, plumbum mainly causes convulsions. So I gave you the cause for convulsions. Fine. I gave you the aura, and I gave you the character. Fine. During convulsions, they go into an unconscious state. That was related to convulsions. Then we spoke about paralysis. Okay. What is the character of paralysis? Which group of muscles go into paralysis? What happens to the paralyzed part? Fine. What will happen to the paralyzed part? The paralyzed part will go into atrophy. And we also saw muscle weakness can go into proper paralysis. Okay. And from head to toe we try to understand where all we have paralysis. In the eye, where did you have? Upper eyelid. In the tongue, which part? Left. Mouth, any other part got paralyzed? Palate. And with the anatomy, what we saw is the esophagus. Fine. In the esophagus, the muscles go into paralysis, only solids go in, and liquids go in, solids come out. Okay. And lower down, we saw the rectal muscles, constipation. The bladder, paralysis, there will be incontinence, retention, or dysuria, difficult urination. Lower limbs paralysis after parturition. Anything we missed? Wrist drop, good. Wrist drop, ankle drop. Yeah. GB syndrome. multiple sclerosis, spinal sclerosis, good. So this is a small picture you need to get. If you understand material like this, you need not go home, by heart, Allah. Let them ask what they want. You have to be confident enough. Fine? Any quick questions? See, the comparison of paralysis for PGs I have uploaded in YouTube under causticum. If you are interested, out of your interest, who wants to know more about paralysis, when you have time, you can just go through those videos. If you are interested. Otherwise, at least focus on Plumbum. So next class, what we will try to do is, what is left over in Plumbum? 3 more components: GA, mind, and the mixture. Whatever is left out, we'll put it under one heading and we'll try to discuss. Okay? All clear? Any doubts, any questions? If you have something, feel free. Huh? Okay. So your friend has a question. If there is ischemia of the brain and ischemic encephalopathy, and if there is convulsions, can Plumbum be thought of? See what happens, it has action on blood. Fine. It can cause anemia. Fine. So anemia of brain, there is atherosclerosis and all. Probably. Honestly, I have never treated. Fine. But if the picture matches, you can definitely think. Okay. Is the question clear? In ischemic encephalopathy, if there are convulsions, can we think of Plumbum? Nice question. I say yes, but I personally have no experience in treating such cases. If the symptoms match, you can definitely think of it. Any other questions? We'll stop. Chalo, thank you.